Good morning, good afternoon, and good evening to you. Thank you for joining us for the 1 hour masterclass on smarter, more affordable healthcare, whether you're joining us live or the recording. I know a lot of people have asked for the recording based on their busy schedules this week. So happy to be able to continue to go through that. Um, so without further ado, let's go ahead and get started. I'm Lee Cole, President and CEO of Breakthrough in Sunnyvale. And just a few housekeeping things today before we get rolling is for any of you who are on, then just or who aren't, recording will be sent out to you, so you will be able to capture anything that you missed, take some notes and things like that. Feel free to add any comments or questions in the chat or Q&A. Primarily, the chat is probably the easiest place for us today. Please silence any devices, although I think we have that pretty well taken care of. And, just familiarize yourself, make sure that your phone is turned off and that you're not distracted from it so that you don't miss something and then potentially ask a question later that may have been answered, things like that. So definitely appreciate your participation today. I'm very excited to share some great information. So a little bit about me. This is my family a few years ago. So definitely good times, and we've been through our share of health issues and expenses and things in the past. So I look at things from both a physical therapist perspective, from a patient perspective, from a father and husband perspective, from a business owner perspective, and I used to actually do medical review. So I used to, evaluate different documentation of clinicians, primarily physical therapists across the country, in terms of that. I got into physical therapy because I dislocated my left shoulder jumping off a 10-meter board in Mexico. We were in Cuernavaca, Mexico, and jumped off a 10-meter board and dislocated my shoulder. Went through physical therapy, saw a doctor, needed surgery, and then back through physical therapy. So I've been through that. And as you'll see later in the presentation, I'll share a brief story about my sleep apnea that I went through as well. So yeah, I just fell in love with, helping others, and now I get to do so on a worldwide basis. Breakthrough sees people all over the world to help them navigate the healthcare system, things like that. Because of my injury, I knew I wanted to go into physical therapy from the beginning, so I went straight to the University of Oregon, which was a great experience for me. And I knew that they had a great pre-physical therapy program, including anatomy labs, which had cadavers, which is typically only reserved for medical school. You don't even typically get that in most physical therapy programs. So to have cadaver lab in the anatomy program as an undergrad was quite a privilege. I then lived up in Portland for about 7 months, went to physical therapy school in the Netherlands. So I was able to learn physical therapy from some incredible people, and physical therapy did evolve from countries like the Netherlands, Norway, Britain, Australia, New Zealand, and Canada are really kind of the pioneering, regions of physical therapy. So it's pretty incredible to be there, as well as just seeing all sorts of different cultures and languages and traveling all over Europe over that 2 year period, and things were great. I did work at another local clinic, which was incredible, but it was fairly stagnant. And so I had the opportunity to be able to start Breakthrough in 2004. So now, as I give this presentation, we're over almost 21 years in. So anyways, wanted to share about that. Let's get right into it. So all of us that are tuning in today realize that the healthcare system is a little bit frustrating and costly. What I believe are facts are that what is exactly what you see here is that all of our insurance, we have continuously increasing premiums, increasing copays, deductibles, coinsurance, and out-of-pocket maximums. So rising costs on every single phase of healthcare is currently a fact from my experience. Meanwhile, this is a term that not even many healthcare practitioners, even physical therapists that I interview, I ask, do you understand about narrow networks? And they have no idea. So basically, insurance companies they benefit when you have less visits, right? When you seek care less, then they benefit because they're collecting those increased premiums, but the less that they have to pay out and manage and all of that, the better. So, for example, when we first started in 2004, we chose to be not in network with Blue Cross of California for many reasons, which are not important for this presentation. However, if I were to call them today and say, "Can we get in your network?" they would probably say, "Our panel is closed." So it's not that we're not good enough as a group to be able to get into their network. It's just that if they have too many practitioners available to you, then access to care is easier, and then you will likely get visits. Whereas if it takes you 2 or 3 weeks or more to be able to get into to get into a physical therapist's office or a doctor's office or something like that, then maybe in 2 weeks, let's say it's low back pain, maybe in 2 weeks, your low back pain is 50% better just by having rest, and then you cancel that visit. So now the insurance company saves money. It's helpful for their shareholders while you've just been stuck kind of dealing with your pain for 2 weeks instead of getting the care. Along with the fact that they do, all sorts of denials and create other things there. But it's just interesting to know that that's kind of what happens there. So let's talk about, specifically in America. Obviously, this is helpful for people all over the world, as we've seen with some of our past webinars. But focusing on the Americans, the U.S. ranks 38th in healthcare across the world, which is crazy for a country that, should be the leader. 58% have attempted an average of 5 different diets in their lifetime. 79% fail. So, we're doing some things wrong, and it's hard to find ways to good health. The majority of women struggle to prioritize, and I know that actually as we give this, Mother's Day is coming up, so happy early Mother's Day to those mothers out there, and belated to those who might be watching this at a later date or a completely different time of year. But anyways, the women in our lives tend to put themselves last. They take care of their husband or their partner or significant other, and their kids, the dog, everyone else, and then they're last. So that's an important thing, and it's an important time to be able to share for those of you, not just the stat, but take this as a lesson to take care of yourself first. Just like when we get on an airplane, one of the things that they say is that, when you're traveling with a minor child or something like that, that you put your mask on first, because if you pass out, then you're not going to be able to help your child. So definitely, I think we've learned things a little bit differently, trying to be so selfless. And the reality is sometimes if we do take care of ourselves first, maybe we are in a better position to take care of others and have other people around us be, happier and things like that. I know that's certainly the case from what I've seen in a lot of different scenarios in my life. So 6 out of 10, 60% struggle, 63% make their health a priority. And then there's some interesting trends as you look at generations. I'm not a big, generational guru by any stretch, but this was an interesting statistic where, as you can see, from the silent generation to the boomers, it's just getting worse and worse. We're 39%, and then now for Gen Z, it's 74% are struggling to make their health a priority. More and more women are having to work and take care of the bills and do the groceries and, kids' sports and all these things. They're doing it all, and it's just, it has to, we have to correct that. So if you're in a situation or know someone who's in that situation, I definitely really encourage that. Otherwise, you're going to start to see, even more increases, which is an area that we do see, but not a topic for this meeting, on mental health. It's just not sustainable to continue to move in this direction, and it's not fair. So men, we also seem to put ourselves a little bit last, but kind of in a different way from what I gathered from the stats, is that, we don't typically find a consistent provider. So all of a sudden we have a problem and someone's like, well, just call your GP, your general practitioner. And many of us say, well, I don't have one. So then you're just going to urgent care. So then that visit alone going to urgent care as opposed to a provider that you might be established with, even if it's just going in for a physical once a year and just having one checkup type of thing, which is it can be very cost effective and, helpful for all of us. We should do that. And then, exercise guidelines and, obesity and, diet and all those normal things. So, 40% delay their care because of the financial costs. Well, that's, again, one of the reasons for today's webinar is to be able to go through this. But, why is that? We don't trust the healthcare system or our providers. It used to be that we would just go in, 30, 40 years ago, we would just go into the doctor and ask them, and they were the guru. Now we're going online, or we go into the doctor, and then we don't really feel that we get the right information. So then we're Googling or doing Chat GPT or doing all sorts of other things. We say that our problem isn't that bad. So we wait for it to continue to get worse before, we finally say, okay, I need help. And then at that point, everything you do costs more, because now it is an ER visit or an MRI or imaging, when, if you had just gotten in and gotten seen very quickly, then that would have been completely prevented. So these aversions to going in and getting care are costing people a lot of money. So yeah, there's some other video. There's links also on these slides, and we will send these slides to you as a part of the package for those of you who did register for this. But prevention, right? There's all sorts of articles and news coming out. That preventive healthcare is really critical. Patient fees range from $300 to $450. And the insurance doesn't even cover that, especially if you haven't hit your deductible yet. Then you're going to be on the hook for all of that, which could be a 4 to 8 minute visit with a doctor who barely even touches you, if at all. So that makes sense why people aren't going in. And to find a primary care doctor, I have a lot of people here at the clinic who will come in and say, who do you recommend? And they can't find anyone, or if they do find someone, there's not many practitioners, especially general practitioners, in private practice anymore, because they can't afford to provide the kind of care that they want to give you with the insurance contracted rates. So they've all sold their practices or not even done it, and then they're just working for a bigger institute. And when you go to a bigger institute, because they've got better negotiating power with the insurance company, it's going to cost you more, along with the fact that access may not be quite as simple. So lots of different, information that's available out there. And that takes me kind of right into where I'm going here, which is, hospital-based versus private. What people don't realize, a lot of people, they'll call in, are you in network Blue Shield? Are you in network with Blue Cross? Are you in network with Cigna? But in-network status isn't what it necessarily used to be, because if you go in network to a hospital-based provider that has much greater leverage against insurance companies, the contracted rate for in-network services at, again, we're in the Bay Area, so, and you'll see an example in a couple of slides here, Sutter Health and Stanford, they get a higher rate per visit than a private practitioner. So people think that just going in network, and then they're protected by their insurance, but that's not really the case. They may be paying a lot more, in some cases 3 to 5 times more, which you'll see in a few minutes. Here it says, hospital-based doctors that provide chemotherapy charge roughly 4 to 5 times the cost of oncologists who practice independently. That is a major concern. And then also I didn't have it in here properly, I don't think, but also looking at prescription medication, making sure that when you go in, you ask if there's a generic medication. Sometimes there's other loopholes in getting medication from Canada or something like that. So, be aware of what you're doing and where you're getting it from and all of these things, but there's some different options that could be available. MRI, right, can cost from $2,000 to $3,000, whereas if you went to just a smaller imaging center, it might be $450 or something like that. So that is a major change that can save you tons of money with some guidance. So be aware of that. So here's my sleep sample study. And obviously, as you know, I'm pretty well versed in this stuff. I specifically asked the clinician, the doctor in the office when I scheduled my initial consultation because I knew I needed a sleep study. So I didn't say, well, how much is it going to cost? Are you in network or whatever? But I found out specifically what the amount was going to be for the sleep study. Um, so I had it all set up. And then, as you can see in here, ironically, the sleep study that I had done after the consult, a week later or whatever, was literally in the same room. So this doctor had a partnership with a hospital. So their office was literally kind of adjacent to the hospital. And then they would actually use some of those rooms, the treatment rooms, um, for the initial consult. So that's where my consult was, and then my sleep study was there. So I figured for sure everything that I had already asked them was good until I got the bill, and it was $1,500 for that, at least my portion of the sleep study that was there. Versus then when I went back, once they determined yes, you need a CPAP machine and we need to do that, then they wanted to do a new sleep study to see if that was improving it, and also to see what level they needed to be able to set my pressures at and all of those things to give me the proper sleep and health for the future. So, 2.2 times the cost. I ended up calling the institution that I was at and explained the whole scenario. I had notes on who I had spoken with. And so I was in a much better position than most people to be able to negotiate out of that $1,500. So it's really important that when you call any practitioner, as much as possible, that you get that information and that you call your insurance directly on your own as well. That's something that we recommend to all of our patients who call in, because when we call your insurance, to verify your benefits for physical therapy services here at Breakthrough, our information back to you is only as good as what, Bob at Cigna said or something like that. And it's just a note. So, 2 days later, Bob could be gone. So, it's really important that you've got good notes that's there, and oftentimes that you don't blame the practitioner. They're trying to do everything they can to be as transparent as possible. In most cases, at least we are. But how a claim processes and all of those things, you just never know the nuances of it. So it's really important for you to call your insurance and take good notes there, and then be able to, kind of fight your way through it on the tail end if it's needed. As of 2021, this is really important to be aware of, is that it became required for hospitals to have a cost estimator tool on their website. Now, these hospitals have gotten more savvy, and it used to be a lot easier. I had a better example a couple of years ago that I could have easily walked you through, but it's gotten so complex that I would just take you on a really crazy maze, walking you through this. But it is required for them to have an estimation on what those services are, except for, as you'll see in a slide or two, it's not quite so transparent or clear. So here it is, Sutter Health. This is a local, hospital system by us. If you just looked at the cost of a physical therapy evaluation, as you can see, Sutter is $467, whereas if you go into a private scenario with the same insurance, $135. Typically, along with the evaluation, there's some other neuromuscular education, some other, these are called CPT codes. So this is a code that all practitioners use, or multiple codes, for any procedure they do, whether it's soft tissue mobilization or you go to the hospital and it's a Band-Aid, or, one, crutches, that they give you, or, every suture that they put in, everything has a certain CPT code associated with it. So when you look at it at Sutter, if you did an evaluation, you had some neuromuscular education, hands-on therapy, and therapeutic exercises, it would be $1,000, $1,143. Whereas if you did that at a private facility, it's $259. 883.77 savings, 4.4 times. So when I say 3 to 5 times savings, I'm serious. So even if it was, just the 467, um, then, it would be 1.8 times less. So, or 1.8 times more, however you want to look at it. So very important to be aware of the difference between a hospital-based facility and a private facility. Here's another example from 2018. So again, this is 2025. So we're 7 years in the past. It was $310. This is literally pulled from an EOB, or explanation of benefits, from a patient of ours who was generous enough to share their information. So they were charged $310 for physical therapy services, and this wasn't even an eval or a discharge report or anything like that, which typically comes at a higher rate. This is just a service. So this is 7 years ago was 310. Let me back up a second. $259 today, 7 years, and you can imagine with inflation and cost and all of those things, especially right now, what a difference that could be. So this is real data. This is not made up, I promise. Stanford, they've made it a lot more complex. It used to be a little bit easier, but actually it wasn't easier. I called them probably 7 years ago and asked, how much it would be for a physical therapy visit. And they said it would be $1,500, which I knew they weren't really going to charge $1,500 a visit. But this whole thing was set up as transparency, so they were just throwing out numbers. So it wasn't like I could go by that. And anyone who did, and I know many people who chose to not come here out of network, who then went in network and then ended up going back, which is one of the reasons I got, that this other person had brought in the EOB, because they were mad at our staff that there was going to be these costs, and we were trying to be as transparent as we could. And they went and had these sessions, which again wasn't $1,500, but it was 310. They came in and it was significantly less for them, and they got better and had 40 minutes of one-on-one care and all of these things. And now for Stanford, I went and looked at it just a little bit, a few weeks ago, and it's a JSON file, which is a really complex file to kind of mess around with. Certainly not something that most of you would take the time to do, especially since by the time you got it, you wouldn't even know if it was true or not. So anyways, it's really also important to look at cost per visit, especially when you look at like physical therapy services or anything else that you're going to be doing over time. Chiropractic would be similar. Don't necessarily look at it as cost per visit, but if you have a back problem and you're not able to get back on the golf course, you're not able to, go walk on the beach with your spouse or significant other, or dog or kids or whatever it is, look at what is the cost to get me from where you are to where you want to be, as opposed to X visits. Because in this just brief example, 20 visits, and some physical therapists are an hour, some are 40 minutes like we are. 30-minute sessions, you might get bounced around from therapist to therapist, or just have 10 minutes of time with a physical therapist, and then the rest with one of their support staff members or something like that. So there's a lot of differences in terms of what you're going to get, but also 20 visits for 30-minute sessions versus 15 visits for 40-minute sessions. So that gets you to 10 hours of therapy, but you might save 5 visits of drive time. You might create 4 more hours of your own time, which for all of us is pretty significant in our lives, especially if you've got kids and other responsibilities or multiple jobs, who knows. You'll probably get the same or a better result. And then you're also going to save money on copays, right? Because you're going to have fewer copays. So you don't think about really what that full cost is. So it's really important to be able to go through and look at that cost versus value. Again, getting back to putting ourselves first, studies indicate that individuals who maintain regular self-care lower stress levels, increase productivity, improve relationships, just so much more clarity, probably better sleep, all the things. So know that as you prioritize your health and as you do that, then things will be significantly better. Global wellness. So wellness industry, as a result, I said earlier, how it's better to be a little bit more preventive as to the way that you look at things. I think specifically related to that in the men's side where we don't even go to the doctor. So even just going to the doctor once a year and getting an annual physical and asking some questions and just making sure that you're on track is good. But then there's so many other areas of fitness, whether it's, workout groups or, apps or, so many different things. But this industry is forecasted to hit $9 trillion by 2020. That's huge. So this is absolutely growing, and there's a reason for it. One, people don't want to spend their time and money in healthcare, and they'd rather just, if they're going to spend it, they'd rather use it as an investment in their health and wellness, whether it's, sleep tools, um, mindfulness apps, such as Calm and things of that nature, all sorts of different resources available. Many people who have a friend or acquaintance as a medical professional, that can be very helpful, but sometimes it's also hard because your friend doesn't necessarily want to be giving medical advice and be in a position where if they say something that's wrong, then now you've gotten in the way of the friendship. At the same time, there's a lot of things that we can do to be able to help guide you, or at least ask some good questions so that then you have tips for, what you might ask your practitioner or what you might, look up and things like that. So, but most people don't necessarily have a friend or acquaintance that is a medical professional, or they don't want to utilize that resource or share what's going on with them. So what do? Well, they go to Google, YouTube, ChatGPT, Instagram. I've seen it all. This is literally a text thread that I had with an individual that's local, who is aware of some of the services, where they said, yeah, I followed, some therapists on Instagram for some stretches. And so I instantly, did one of these. This person recognized that was not helpful. And then they did submit a form and then got some help, directly from one of our therapists through our virtual health consultation. Ended up coming in for care because they needed it, all of these things. But, it's just crazy because when you go to Google or ChatGPT or YouTube or Instagram or anything like that, you ask, best 2 exercises for shoulder pain, for example. Let's just say it's a right shoulder problem. So Google, ChatGPT, YouTube, Instagram, all of these things, social media, chat groups, they can't look at you. It's not asking you questions. It's just spitting out answers based on an algorithm. And the reality is the best 2 exercises for your shoulder pain right now are probably different than the best 2 exercises for your shoulder pain 2 weeks in advance or 2 weeks prior. It's also very different from what the best 2 exercises might be for my shoulder problem right now or 2 weeks ago. So it doesn't have the ability, these tools don't currently have the ability to ask you the questions that need to be asked, to look at you the way that we can in a virtual session or in person and things like that in terms of what your range of motion is. It doesn't know that you lift your shoulder like this as opposed to like this. So it can't act, doesn't know your ability. It won't, some tips on what to ask a medical professional probably are there, but not necessarily really geared to your, situation. They don't know what the right exercises are. If you look at the exercises, there's no one telling you if you're doing it wrong or, explaining in very detailed where you should feel it, where you should not feel it. If this is, if something happens, go, where to go type of thing. That's something that we are able to do. So it's really helpful to get in sooner rather than later to see, a physical therapist or something like that to be able to figure that out. So you want different options. Direct access. Most people are unaware that you have direct access. There's direct access laws all over the country in terms of being able to see a physical therapist. So if you were to go to this link here, which we have on our website, we have the most current version. So if you then clicked in here, then you would see from the APTA, every state, California, Colorado, Connecticut, all the different rules. In California, it's 12 visits or 45 days, whichever is less, in terms of being able to go in to see a physical therapist for one-on-one care and assessment. So a lot of people don't know. They think, oh, I have to go to my general practitioner, and so that's going to cost me $450, and then they're going to give me a referral, or they might do an MRI. And so again, back to some of those earlier slides, they're not, going to give you that guidance. But the reality is, you can go directly to a physical therapist, depending on your insurance, how to do that. We also have in here a tip on how to choose a physical therapy clinic. So again, you'll get the link in the presentation, which you can click on. But this is a page that we built out years ago and then updated during COVID on how to find a good physical therapy group by you. What does it cost? It talks a little bit about the cost transparency. Of course, it's not quite the same as it used to be, so it's not as helpful as what we used to have in here. So I'm sorry for that, but depending on what's close to you, you just have to kind of look at it and know that you can contact any facility to try to find that out, especially hospital-based. They should be able to tell you. And then you can click on any of these, or it just kind of goes through, duration of sessions, touring the facility, experience and certifications, things to be aware of, insurance, these types of things. So that's all in there and fully accessible to you. Breakthroughs virtual health consultation services. This is something that is really starting to grow for us. It's been incredible to be able to help people, for us to engage with you, to ask you some questions, look at range of motion. We've seen people in Tokyo, Australia, India, China, Chicago, Colorado. We had a rock climber that we've seen periodically in Colorado to help them through things. One of our therapists has helped another person in, I think it was Virginia or Maryland, for vestibular problems, even TMJ issues, temporomandibular joint. So just opening and closing and kind of knowing what to do there and giving them some massage tips to help with. Parkinson's, even family members. So you might have an aging family member and you're concerned about fall prevention. You're able to send this off to them and or get into a virtual session with them to make sure that they're safe. But we get to look at all sorts of things. We do this for companies, looking at their ergonomics, posture, body mechanics. Do we have 2 monitors or 3 monitors or 4? We did one. I did one ergonomic assessment at a company years ago, and this person had 3 monitors, and the 3rd monitor was in the middle, literally propped up on tape. I didn't bring an example of tape, but the clear plastic tape that you might use to strap a box down when you're moving or something like that, literally had like 3 rolls of tape, and the monitor was just laying on it, almost like a tilted iPad. It was crazy. And so a lot of times it's not so much, stuff, it's just teaching, proper sitting mechanics and awareness and where to be and, where to put the printer, and then not just reaching over here every time for the printer or for the phone, but really, using your whole body and moving from your legs to move in a more ergonomic or athletic fashion towards it. So lots of ways that we help people. There are links here. I don't want to take too much time to be overselling, so to speak, on our programs. But there are videos in here that are really helpful for you, some different testimonials, which, may or may not be helpful for you. So that's good. We do have for the attendees a 20% discounted link available for you. So if you had registered and this is how you're seeing this video, then you can go to this page, which is a discounted option. Same thing, you've got some tips in here. For example, have you taken your child to the doctor and they just told you it's just growing pains? So there's just information in there. This is something that I'm super passionate about, is working with kids and families and things like that. We have people who, if your daughter, for your 14-year-old daughter, is having knee pain in soccer and the doctor says, well, just take a month off and then, ease back into it, what shouldn't she be doing something? Shouldn't she be getting some guidance during that month? Because you can't just take time off, let it go away, and then kind of go back into doing the same thing. It makes you can't expect a different result. So again, that's also why people are frustrated with the medical system, because they know they're going to go to the doctor. The doctor's not going to really do anything for them, or what they do makes actually no logical sense, right? Let alone the fact that they have a medical degree and license and years of experience. So instead, people are getting their kids in either with us virtually or in person, and then we're walking them through exactly what to do and what exercises and all of those things, and then helping them get back onto the field and building confidence, because this is major for the family. If this daughter of theirs doesn't, get back to being an athlete, and then they, all their other friends pass them by, they might even just determine that they're not athletic, and then they develop other health and wellness problems, different, eating challenges or weight issues, or just self confidence, self image, all sorts of things. Just as an example here, in our sports performance program. So if you were to click in here in past program success stories, there's just an example right here of a program that we did years ago. But this individual was jumping down from the box and then supposed to jump back up. And if you watch this video, which I won't take you through today, her knees crash in, and when she gets up, it's horrific. And after just, 8 weeks, in a group situation, so we probably spent, not much more than an hour with her at all over an 8-week period of time. She didn't have growing pains. She didn't know how to use her body. She didn't have core control. She didn't know how to use her quads, her glutes. She didn't understand. Nobody was teaching her that. Since this isn't a highly competitive soccer league, so this is what all the parents are spending their money on, thousands of dollars every quarter to get their kids on the best team, and to, do all these things, and traveling all over the state and all over the country. And if you watch this video, it's a problem. So we got to solve it. And then also with our virtual health consultations, we do all sorts of things for companies. So if someone were to click in here, whether you're a business owner or in HR, this is a great way to get a 30-minute complimentary consultation, just one-on-one with me, and a similar session like this. And we'll go through and figure out what's going on, what strategies have you used in the past, what are you looking to do to improve health and wellness for your organization in the future, save costs on healthcare, all of those types of things. So happy to be able to go through that. We're going to send a recording of this to all the registrations, things of that nature, and then we'll just kind of open it up for Q&A today. And I'm going to go ahead and stop the recording for Q&A so that it's easier for those who are in attendance to feel comfortable.